Let's talk about job opportunities in regional Australia after clearing AMC1. So once you clear AMC1, you have few options like what kind of jobs you can apply, specialist, GP, and what's the time frame and everything. You can apply as a non-VR GP, like directly working in a GP clinic after clearing PESCI exam. His PESCI is an interview-based exam for a specific clinic. You clear it, you come to that clinic and you work under some GP, and from day one you will be seeing patients. You will be getting paid for each patient that you see with some basic salary as well. Second thing is you can get a job in hospital. In hospital you can work as an RMO, a registrar, intern, whatever position you qualify for. For example, if you have already done internship in your hometown and you have registration, you will be working here as an JHO, RMO, SHO, any of these positions. That is like mostly PGY2. After internship is PGY1. After that, PGY2 is second year, third year is PGY3. Once you become PGY3, you can apply for registrar positions as well. And moreover, if you have trained in some specialty like medicine, emergency, and you are coming in Australia on your first job, you might get a job directly as a registrar. Now, the difference in both these type of jobs are, in GP clinic, once you cleared your exams and you become a GP specialist and you can open your own clinics. So it's a different pathway to become a GP and not a specialist. But if you get a hospital job, you can enter into medicine training, surgery training, gynae training, and also you can go back to GP training if you like. So from hospital, you can do whatever you like. For example, now the campaigns are open for different positions. Now you will be seeing some training position, non-training positions. So if you are already working in Australia and you want to enter medicine training, you will be applying for training positions. But if you are from India or any other country and this is your first job, you will not be applying for that. You will be applying for non-accredited training, or a PHO or a RMO straight away without training. But after coming to Australia, after 1 year of supervised work, you will be eligible to enter any training, and then you will be applying for training position in these same campaigns. Now, GP training is around 3 to 4 years. If you want to do some special interest in dermatology, pediatrics, emergency medicine, I have seen many GPs with special interest in dermatology. They just remove the skin cancers, small incision stitches, and they earn a lot, and their bookings are 6 months in advance. So for 6 months they are fully booked. So the money point of view is really good. As a specialist, money is even better, but the pathway is a bit too long. It takes around 6 years of minimum work, 3 years of basic training, 3 years of advanced training, and sometimes if you like some intervention branch like cardiology, gastro, then you might have to do extra PHO years between getting into advanced training to make your CV look even better. So this pathway is even longer, but the salary difference is not very much. As a GP, if you are earning $300,000-$400,000 per year, as a specialist, you will be earning around $600,000-$700,000. But if you are doing private practice, there is no limit in both these professions. So money is not a question here. You will be earning money if you are a doctor in Australia. The question is what you want to do, how long you want to study. If you want to finish things off really fast and from day one you want to start seeing patients as a GP, go for GP pathway, become a GP specialist in few years and open your own practice. No weekend work, no nights, nothing, just 9 to 5, 5 days a week. Public holiday is a public holiday. So if you want to be a specialist, as a specialist, if you are working in a public hospital, you might have to apply for leaves when you go. The leave is not much of a problem if you tell them in advance. But if you are working privately, then you are free. Now, when we are talking about regional Australia, all these jobs are available in cities and in regional Australia. But as your first job, there are higher chances of getting in a regional Australia. Why? Because if somebody is already working in Australia, they like to move to city, just like me. I was working in regional Australia for last 1.5 years, and then I started my training in Brisbane city. And I don't know where I'm going to go after my advanced training. If you are getting your first job in Australia, There are more vacancies in regional Australia. It's easier to get into. So it's a smooth transition into Australian healthcare. So I really loved working in regional Australia. And if you ask me, I might end up working in regional Australia anyways. So this video will clarify many of your doubts. And if you want to ask something that I missed, you can comment down and I'm happy to answer. See you. All the best.